Hey there. Let's dive into why personal protective equipment, or PPE, is absolutely crucial for safety in healthcare and beyond. First off, PPE includes various types of equipment designed to protect different parts of your body from hazardous substances, infectious agents, or physical harm. Let's break it down. These protect your hands from chemicals, infectious agents, and bodily fluids. For example, in healthcare settings, gloves are essential when handling blood or body fluids or when dressing wounds. Remember to change gloves between procedures and practice hand hygiene before and after use. Gowns protect your clothing and skin from infectious agents and harmful substances. Think about a healthcare worker treating a COVID-19 patient. Disposable isolation gowns prevent pathogen exposure. Securely fasten your gown and remove it carefully to avoid contamination. Masks, like surgical masks and N95 respirators, protect your respiratory system from inhaling infectious particles or chemicals. During outbreaks like COVID-19, healthcare workers use N95 respirators to filter small particles. Ensure masks cover both nose and mouth snugly. Goggles and face shields protect your eyes from splashes or droplets. For instance, a dentist might wear goggles to shield eyes from blood splatter during procedures. Clean and disinfect eye protection between uses. These prevent contamination in sterile environments. In an operating room, head covers keep hair and other contaminants out of the sterile field. Securely place and remove head covers to avoid cross-contamination. Shoe covers protect feet from hazardous materials. In a lab, shoe covers prevent pathogens from being carried outside. Choose footwear based on the risk level of your environment. Aprons offer extra protection against harmful chemicals or large fluid amounts. Laboratory workers handling corrosive chemicals might use chemical-resistant aprons. Wear aprons over gowns and dispose or decontaminate them after use. Proper PPE usage starts with donning it correctly. 1. Perform hand hygiene. 1. Put on the gown and tie it securely. 1. Wear the mask or respirator. 1. Place goggles or face shield. 1. Don gloves covering gown cuffs. For doffing PPE, avoid self-contamination. 1. Remove gloves first. 1. Untie and roll off the gown. 1. Carefully lift eye protection. 1. Remove the mask last without touching the front. 1. Perform hand hygiene again. Think about specific scenarios. During the COVID-19 pandemic, PPE was vital for preventing virus transmission. Healthcare workers used N95 respirators, face shields, gloves, gowns, and shoe covers when treating patients. In laboratories, PPE like lab coats, safety goggles, and gloves are necessary when handling hazardous chemicals. On construction sites, helmets, steel-toe boots, and high-visibility vests prevent injuries from falling objects or machinery noise. Training is essential. Proper PPE training ensures workers know how to don, doff, and dispose of PPE correctly. For instance, a new nurse learns how to safely remove contaminated gloves and gowns, minimizing infection spread. To wrap up, PPE is vital for safety.